Good afternoon, everybody. Welcome to this afternoon's post-cabinet press briefing. My name is Leslie Ann Johnson, and we're having the press conference at this time because, of course, we hosted the official opening of Renegade Rum this morning. So we're talking health, but this afternoon we have with us the Minister for Health and Social Security, the Honorable Nickolas Steele, as well as the Acting Chief Medical Officer, Dr. Taisha Donnell. So good afternoon to all our colleagues joining us via Zoom, those of you, the viewers, joining us on Channel 22, our Facebook page and the YouTube channel, and, of course, those of you in the diaspora. It's always good to have you. Without any further ado, we will hand you over, first of all, to Dr. Taisha Donnell. Good afternoon.
Good afternoon, and thank you, Leslie Ann. Pleasant good afternoon, Honorable Minister, our host, the media, and persons listening in Grenada, Carriacou, Petit Martinique, and in the diaspora. A pleasant good afternoon again. So today I'm going to give an update on our current epidemiological situation regarding COVID-19, and then we'll go forward. So today we have a total of 33 new cases out of a total of 435 new tests done. This gives us a positivity rate of 7.6%. So as we note, there's been a nice trend downward in terms of our positivity rate. Presently, in terms of our active cases, we have just a total of 167 active cases with 70 recoveries. Of course, we like to talk about our recoveries because it shows that a lot of persons are recovering from this disease, and we're very happy to report on our recoveries. In terms of our vaccination rate, of course, we continue to battle with our level of vaccination, but we're happy for where we are at this juncture, but we really hope to get to a better place. And presently, we continue to have just over 33% of our population fully vaccinated, with a 4.9% persons who are partially vaccinated. And in terms of our booster shots, we have a 4.7% of persons with booster shots. So in general, we'd like to say that we're seeing a downward trend in terms of the number of positive cases in our population. However, of course, we continue to ask persons to follow our protocols, adhere to the guidelines, and of course, vaccination is important. We want to encourage persons to continue to try our best to get vaccinated, encourage our friends and family members to get vaccinated, because, of course, through vaccination, we would be able to go back to some sense of normalcy, although we are already working toward that, taking baby steps. So vaccination is the key to getting back to regular life. Let us all try to encourage each other, and if we have doubts, let us ask our healthcare providers so that we can clear up all of our doubts, and let us try to get vaccinated, increase our uptake, and let us try to work towards normalcy back in our population. Thank you.
Thank you very much, Dr. Taisha Donnell. We'll hand over now to the Minister for Health and Social Security, the Honorable Nickolas Steele. Good afternoon, sir.
Thank you, and good afternoon to all of our viewers and listeners out there. Again, it's always a pleasure to be here, especially where we are seeing positive trends, positive developments. And as Dr. Donnell has said, the positivity rate here keeps declining. We have been able to maintain an extremely low level of hospitalization with respect to the number of cases as well. So what we see here happening in Grenada is what we see happening almost everywhere in the world, that it does appear that with this most recent variant and the most recent wave, that we are seeing a end of the bad part of COVID. Unfortunately, we will not see an end of COVID because COVID will remain with us, endemic with us. But we do believe that we can begin to, as you have been hearing from us in the most recent weeks or so, we can begin to contemplate further easement. As such, from this week, the Cabinet did meet, and under the recommendation of the COVID Advisory Committee, there would no longer be any limits on gatherings for fully vaccinated persons. It is being contemplated as to how we can move forward also with non-vaccinated as well. And over the next couple of days or so, that will be discussed. We also believe that it is all can be contemplated now for churches as well, that there would not be a need for the 6 foot or 3 foot distancing in churches. We do recommend or require that persons would still wear masks when attending services, but we look forward to contemplation. It is not yet, but we look forward to the contemplation, maybe by the end of the month or into next month, of the mask mandate being removed as well. And so the social distancing mandate can now be eased. The mask mandate we have seen, and Dr. Donald will confirm, and most doctors, that it has worked. It has helped to slow. And while Omicron is still around us, we still think it's necessary for the time being to continue wearing masks. We will always be seeing cases of COVID-19 throughout Grenada as we move forward. 2 reasons. One, as we said, this virus is endemic. But more specifically, because of our low rate of vaccination, we will always remain vulnerable. But we can go back to as close as possible a new norm, and that is what we are striving to do, and that is what we will continue to monitor, and as quickly as we can, we would look at. I truly do hope, if the current trend continues, that we can be looking at most, if not all, of our restrictions, travel included, being changed by April. March, April. And I think most countries are contemplating that too. So which is good news for us all. And in particular for the so many Grenadians that have been making the sacrifice to keep us as safe as possible. So having said that, I think it is just for us to contemplate, as you are seeing this weekend as well. Dr. Donald can confirm as CMO that there's been quite a lot of easement with respect to the restrictions and quite a lot of permissions given for activities. We do hope that persons celebrate with a sense of personal responsibility, not just for COVID-19, but personal responsibility across the board, and look forward to us coming to you again in the coming weeks and month with further announcements, because we have on the other side further announcements of easements. Thank you.
Thank you very much, Honorable Minister. Colleagues, good afternoon. I see a few of you already ready with your questions. We have GBN first. Good afternoon.
The question to the Minister: last week you would have highlighted the 3-person or 3-man subcommittee to really look into some of the restrictions. The restriction for no limits to unvaccinated, is that part of it? And when can we expect pronouncements relating to Carnival?
I was wondering how long it would take for the Carnival question to come up. I didn't expect it to be on the first question. But the restrictions, yeah, what I said, the committee is deliberating. We're not going to get everybody vaccinated in Grenada. We do need to get as many people as possible vaccinated. Otherwise, as I said, we will always remain vulnerable. The gatherings and making a difference between fully vaccinated and unvaccinated is not to spite people. It most definitely is not. It is to try and make sure that risk is reduced as much as possible for the time being. But there comes a time where we will move forward with no restrictions on gatherings, and that it will not matter whether you are vaccinated or unvaccinated with respect to moving about or going to places. It will matter and continue to matter with respect to an individual's risk to COVID-19 and ability to fend off should they get COVID-19. As we're seeing, all of the persons in hospital are unvaccinated. All are unvaccinated. We do not have a vaccinated person in hospital right now. And that trend continues. We see the odd vaccinated person, and it is for this reason that we still want to encourage people to get vaccinated. With respect to Carnival, I mean, I said we're easing, so you'll get announcements as soon as they're appropriate.
Jared, any other questions from you for the moment?
Yes, I have one more. In terms of, we had a major event over the weekend. Are there any potential spill-offs in terms of increase in cases relating to it, as well as we've witnessing England lifting some of the restrictions in terms of persons who are positive no longer have to self-isolate at home. Is that a concern, or how would you address such a situation that is evolving in England?
Well, let me start with the last question. I'm not sure of anybody who's positive not having to self-isolate. Yes, you would. The time of isolation does vary now and has been reduced based on whether the person is vaccinated or not. And from day 5 or day 3, someone can test. And if they test negative, then they are free to leave that isolation. But it is still necessary for persons who are positive to isolate. The events over the Independence weekend did not produce any noticeable spike in cases. We are expecting quite a few events in Carriacou this weekend for their carnival. And we have been given permission for most, if not all, of the requests that came to us in Carriacou. And we will monitor. I think Carriacou would be a good test of us moving forward. But there's no reason why the people of Carriacou should be suffering. Let us try and open up and see. I think everybody in Carriacou knows what the risks are. Everybody in Grenada knows what the risks are. We're all monitoring. We know the number of cases that exist, etc. We know that this variant, the Omicron variant, has been mild. We all know somebody that's positive. And so we know for a fact. We have unfortunately lost a few persons to this Omicron variant still, and that will continue. You'll continue to see that regrettably, but it is not inundating our health system, and as such, we move forward with COVID-19 around us.
Thank you. Nancy McGuire, good afternoon.
Good afternoon to everybody. When the subcommittee is deciding on whether to ease the mask restrictions, is there any connection with that decision and where the positivity rate is at? And do we just keep hoping the vaccination rate will continue to increase? Or does that vaccination rate also influence the decision about masks? Thank you.
Well, I think first off, the committee does not make any decisions. They advise the cabinet or the minister and the cabinet. The decisions are made by the cabinet. The positivity rate, yes, always is something that we will monitor and continue to monitor. As with any other contagious disease. Is there a link with the wearing of the masks? To an extent, yes. Yes. I think our positivity rate would be much higher if we didn't have a mask mandate. But after a while, which is what the committee is contemplating, there comes a time where we can contemplate not wearing the mask. I do hope that it would become a social norm now that when somebody is ill, that they wear a mask. But it wouldn't be law. That's what I'm looking forward to us getting to in the not too distant future as we proceed. Getting there, we can get there much faster, as you are seeing with other developing countries, if our level of vaccination was higher. As such, we need to be a little more cautious.
That's it from you, Nancy?
Yes, thank you.
Okay, great. MTV, good afternoon.
Hi, good afternoon. I have one question. With all the restrictions that are being lifted, we have crickets coming up in the stadium in March, I believe. Are there any plans in place? I know it was said that we are going to only have vaccinated people. Are there plans in place to ease the restrictions for the cricket matches?
As far as I'm aware, the cricket is a fully vaccinated event, and that's not just a local government decision, but a mutually agreed decision between Cricket West Indies, the UK or English team, as well as us. So I don't see that changing, but as we just announced, there are no restrictions on the size of that gathering because it is a fully vaccinated event. That will continue, that's contractual for the event. So we don't have any say on that anymore.
Any other question, MTV?
No, that's it for now.
Great, thank you. Linda Straker, good afternoon.
Hello, and good afternoon to you, Les, and the Minister and the acting CMO. My question has to do with the mask mandate. The Minister disclosed that no physical distancing anymore, but we have to continue wearing masks. Can the Minister tell us whether or not St. George's University has special permission for the compound not to be mandated to wear masks? Because yesterday I would have seen on social media persons saying that the university has said to the students they don't necessarily have to wear masks on the compound. So can you explain to us if special permission was provided to St. George's University? My second question is with, he mentioned about England and all the new criteria and restrictions been lifted. One of the things that is also being done is that persons now have to pay for the tests. Can the Minister tell us whether or not, at what stage will government will no longer be offering the test for free and persons will now have to pay for the test? Because it is now not just in England, but it's happening in other parts. When they reach a certain level of vaccination, the government stop issue free tests and persons now have to pay for the test. That's my two questions for now.
Okay, Linda, with respect to masks, there are numerous environments here in Grenada where, because they are fully vaccinated environments, the mask isn't required once you're in that environment. Restaurants, bars, clubs, and so if it's a fully vaccinated event, then in most instances, and St. George's University made a very bold and appropriate step some time back that they were a fully vaccinated environment, and as such, you would see their ability to be more lax with respect to these types of mandates. Their results, test results, came in today too, and no positive cases from them today on the tests that they have done. So I don't see that as an issue. That's what we hope to get to nationally. Everyone vaccinated and no mask mandates. We're going to get sort of a hybrid version of that eventually as this disease progresses, where we don't have all of our people vaccinated, but we will need to move on with respect to the mask mandates. Yeah, once this is considered no longer a pandemic and an endemic, and it's endemic with us, then yeah, I would think in the not too distant future as well, that all the tests, not just the tests for travel, but all the tests for COVID-19, like any other tests that you would have to pay for. For the time being, for this week moving forward, no, but it is moving fast enough that I say let's take it week by week. For this week, no, there's no discussion, no intention right now of charging for the tests when we are doing our local community testing. But yes, you can expect that day to come.
Colleagues, anybody else has questions for the head table?
Yes, yes, I do have another question.
Okay, go ahead.
My other question, the minister mentioned that carriacou will be a testing ground in moving forward. We all heard, we seen yesterday on the Minister Kindra Facebook page that there will be carnival. Can he, the minister, there is a focus on Monday. What is the holiday for only Monday or Monday and Tuesday? Can you just enlighten us a bit more on that? And as a testing ground, what is exactly the ministry is looking for as that testing ground as they go forward? Just enlighten us more about your testing ground, please.
Well, maybe testing ground was a wrong choice of words. Let me go back to the Monday. It's only the Monday, and as far as I'm aware, traditionally it's only the Monday. That's the holiday for Carriacou Carnival. When I say testing, we are observing, we are monitoring. We feel it is appropriate to have this easement and to allow Carriacou Carnival. But we continue, the Ministry of Health that is, to monitor and will monitor in the week afterwards to confirm our belief that it is appropriate and it was the appropriate action. Similarly, in most other countries, when the UK first eased and removed certain mandates, the medical personnel continue to monitor and confirm that the decision was the right decision. There's always the concern that maybe you have to roll back a bit or slow down your movement. I hope that is not the case, and that's what I mean when we say we are using Carriacou Carnival as our first event or first stride into reopening.
That's it from you, Linda.
Yes, thanks.
Colleagues, anybody else with questions? Nancy, you have a follow-up question? Go right ahead.
Yes, I do. I wanted to ask, in terms of our sequencing, is it just now the Omicron variant that we're seeing? Because last week we had one Delta. And when you're saying you're going to be monitoring Carnival and Carriacou, how are you going to be doing that? Thank you very much.
The same way we monitor the entire nation. It's based on the daily information that we present to you. It's testing. It's based on testing. Persons either coming forward or us going out there and testing individuals. It's worked here throughout the pandemic, and it's worked in almost every country. That's how you monitor the pandemic. Testing to identify which direction any wave is going. So that's how we will monitor it. What was your first question again? That was it? Okay, just okay.
Colleagues, anybody else? Callistra, do you have any questions? Anybody else, colleagues?
Yeah, I have a question. If it has not yet been addressed, because I joined late, if it has not yet been addressed, is the state of emergency lifted? And if not, when can we expect that to happen?
The short answer, Callistra, is no, the state of emergency has not been lifted as yet. The Cabinet will deliberate and ensure. What we don't want to do once it's lifted is to contemplate a reinstatement of it. So that's why you may see a bit of a delay and some contemplation and discussions, etc. This weekend would be a good indicator for us as to the significant and timely contemplation of the removal of the state of emergency, and that's from a medical standpoint.
All right, anybody else has any follow-up questions?
Yes, sorry about that, Les, but I do have a question for Dr. Donald. Sometime when we would have had the first and second wave, we would have seen surgeries being put on hold. Can you tell us now whether or not things are back to normal, and how is the hospital dealing with that backlog if they have returned to scheduled surgeries?
So thank you, Linda, for that question. And yes, we went back to normal, but we have since had issues again with staff becoming ill, and we have had to make adjustments again to putting our elective cases on hold. So presently, we're now in the process of evaluating whether or not, how long we're going to put our elective cases on hold. Right now, we'll continue to do all the urgent and emergency cases. So when we speak about the urgent cases, we speak of cases, for example, tumors, any type of cancer, or anything that would jeopardize a person's well-being in the short term. These cases we will continue to do, but the elective cases will be put on hold. We've been trying to catch up with our backlog, but of course it's a process and it will take a little while to clear up all of our backlogs. So at the moment, we still do have a backlog of cases for surgery. Yeah, thank you.
All right, so Colin,
Can I just get one quick
Go ahead,
question,
Calista.
please, Leslie Ann?
Go ahead.
Dr. Donald, it's not related to COVID-19, but how are you as a CMO advising on the recall of the baby formula? I know that you were informed by Abbott of the situation. How are you advising the public on this?
Yes, so thank you for that question, Kalistra. And of course, whenever there's a recall, what we try to do is to get the message out there, and so that the public is informed of which of the different lots of formula are the ones that are recalled, so that persons need to stop using these formulas. For persons who may have missed these formulas, like the actual recall and which ones are the ones to pull back or not, what we would recommend is that all persons who notice that their infants or their newborn babies who have been taking formula feeds, if they notice any signs of illness, particularly any GI symptoms, gastrointestinal symptoms like vomiting, diarrhea, fever, irritability, and even things, for example, like change in your general state, like babies getting very weak, very, very irritable, or very sleepy. Any sign that shows any compromise with your central nervous system or with your gastrointestinal system, we recommend that you take these babies or infants to the physician or your pediatrician urgently, because these are the symptoms associated with the bacteria that were identified in this recall. So it was published, the Grenada Bureau of Standards published all of the numbers, the batch numbers for the different formulas. So we just want all persons who are presently feeding their children with Similac, it's not all of it. Please take note of the sequences. Please take note of the batch numbers of all of the formulas that were recalled, so that if you have any of these in your possession, in your household, then you need to discard it. And of course, any children who were taking or being fed with Similac formula and showing any signs of vomiting, diarrhea, irritability, drowsiness, any form of illness, they should seek urgent care and in a timely manner. All right?
Let me just say, Calista, too, that we're fortunate that at this point in time, as you heard from the answer she gave, Dr. Donald is the acting CMO, but is also a pediatrician herself. So therefore, it's something she takes very seriously, this particular recall.
Calista, that's it from you?
You asked that parents or consumers discard the product if they have it, but today the CEO of Huggins Grenada, the distributors of the product here, are advising consumers to stop using it immediately if it's part of the suspect batches, but also to hold on to the products, I suspect, for issues of compensation and taking responsibility and so on. It's contrary to what you are saying, which is discard it. So can you give some clarity on this? They're saying don't use it, but don't throw it away.
Yes, so it's part of a surveillance system, Kalisha. So really and truly, what you would want to know is of these recalled products, which ones we have circulating in Grenada, and if someone in particular has it in their household, and of course, there is, particularly if you have an infant or a baby who is ill, you would want to know, of course, want to know which one of them, which lot number, which batch number it is, so that you can report it back to the company. So yes, it has to be reported as part of the surveillance process. So yes, you need to report it. If anyone within your household becomes ill as a result of it, you would want to be able to tell them, okay, it was the one with this sequence. So it's part of their surveillance system, and so they can, do their reporting and all the necessary processes that they go through as a result.
Have any illnesses been reported yet that is suspected to be related to those with that batch number from that lot?
All right. So at the level of the Ministry of Health, we have not had any reports thus far. But of course, we would continue to monitor the situation. And of course, these are concerns that we have to take seriously and report it to the necessary company.
Mm-hmm. Okay.
That's it, Kalisha?
Yes, Les, thanks.
All right, colleagues, you're welcome. Colleagues, anybody else with a final question? We have with us here to come after the Honorable Minister and the Acting Chief Medical Officer, the Honorable Yolande Bain-Horsford, the Minister for Sports, Culture and the Arts, Fisheries and Co-operatives. Any final questions from you, colleagues? All right, I take this as no, so you have the floor now for final remarks.
So I would just like to say to our population, everyone in Grenada, Carriacou and Petit Martinique, particularly in Carriacou, I know this would be a very festive weekend. And as we note, this pandemic has been a very difficult time for all of us. And we're now, trying to learn how to live in the time of COVID, how to live in pandemic. Of course, one of the best ways to do that is to encourage and to be vaccinated, increase our vaccination uptake. We want to encourage persons that, yes, we are trying to do some easements. We're doing, as we say, baby steps. And as we progress through the next couple months, we'll be easing further and further back to normalcy. But of course, part of that easement is also related to our vaccination uptake. So we just want to encourage persons to enjoy your weekend, have a good time, but play it safe. Remember that COVID is still there. We're still in pandemic mode. We want persons to take a personal responsibility in their health. We want persons, it's festive time. Don't drink too much. Don't eat too much, right? So be careful because, of course, we're still in pandemic mode. COVID is still around. We still have active cases in Carriacou as well. So persons have to be, of course, vigilant and take care of themselves. Make sure they follow protocols as much as is possible. And of course, apart from COVID, healthy living. So remember, don't overdo it with the drinks. And let's try to have an incident-free and a weekend that is free from too many emergencies. So we just want to, implore, let us get vaccinated. We want you to enjoy your weekend. We want us to all ease little by little. But keep in mind that we're still in pandemic mode. Thank you.
Thank you very much, Honorable Minister. The floor is yours.
Let me continue exactly where Dr. Donald finished, which is that everything in moderation, please. Many of us have missed our carnival, and I'm sure that there are some that are going to truly enjoy this first piece of carnival freedom. Please do so in moderation. Please remember that, yes, COVID is still around, but also alcohol consumption and other things that happen in crowds, etc., to be very wary of that. Respect the law enforcement officers who are going to be up there, doing their best to maintain law and order, while we, or some of us who will be up there, are having fun. As we move forward, we in the Ministry of Health and the government look forward to further and further easements and removals of restrictions that we have had because of COVID-19. Let me reiterate, though, as Dr. Donald has said, and we will continue to say, and we need everyone to accept that the removals of the restrictions as they become possible, it's not a removal of COVID-19. It is us getting to a point where the level of risk is reduced significantly. That risk could be even less if we had a higher level of vaccination, so we will still continue to strive for that. We are going to be having certain vaccination clinics over the weekend, but these vaccination clinics will also be combined now with testing for other, like sugar and pressure, etc. And so we're going to have such a clinic in St. Andrews, aiming for that over the weekend, as well as hopefully in St. Mark's or St. John's, details of which will come out in the next day or two once we have the logistics confirmed. I just want to say thank you again to all of those who have and continue to serve on the front line, protecting us from COVID-19, and that I look forward to celebrating cricket West Indies, and that our next guest coming on, my dear colleague Yolande Bain-Horsford, I'm looking forward to hear what she has to say too. So I'm going to stick around and ask you all to do the same, and let's hear what the Honourable Minister has to say.
All right, colleagues, I don't think I need to say anything. The Honourable Minister just said it, so just please stay with us. We will have, as mentioned, the Honourable Yolande Bain-Horsford, Minister for Sports, Culture and the Arts, Fisheries and Co-operatives. So we will be right back. Viewers, we are back with you, and as promised, we have with us now the Honourable Yolande Bain-Horsford, Minister for Sports, Culture and the Arts, Fisheries and Co-operatives, and she will be making some pronouncements regarding Carnival. Minister, good afternoon.
Good afternoon, Leslie, and thank you for having me here this afternoon. Go ahead.
Yes. Right ahead.
Okay. Well, let me first recognize the members of the media, the listening public out there, as far as the diaspora. I'm very happy to be here this afternoon to share some very important information. I'm sure it brings some smiles on most of our faces. Yes, so our government have been very concerned about the economic, social, and psychosocial implications that not having carnival has had, and if not held for a third year, would have on businesses, the youth, the carnival enthusiasts in general. So consequently, the Spice Mass Corporation was mandated to explore the possibility of having carnival this year, being mindful of the COVID-19 pandemic. So to this end, the corporation presented an initial proposal to Cabinet, and I must say the Cabinet was very impressed with the proposal and the quality of work they have done in planning for the return of Spice Mass. Taking into consideration the implications mentioned earlier, Spice Mass Corporation then consulted with the various stakeholders to address them. They have held several meetings with the different stakeholders and consultations, and today I can now announce with confidence, and you may have heard the Minister of Carriacou and P.T. Martinique, she have announced earlier that Carnival is on in Carriacou. It will be on, there will be a holiday on the 25th, on the 28th, that's Monday coming in Carriacou. So the 28th will be a holiday. Well, I am proud and I'm happy to announce that Spice Mass 2022 is on August 8th and 9th, 2022. Spice Mass 2022 will take on a blended approach with in-house and virtual audience. There will be heavy emphasis on preserving our culture and mitigating risks. The COVID-19 protocols will be in place consistent with the national policy. We must be mindful, however, that the virus is still alive and it's living among us. And so we have to take the necessary precautions. We have to be very careful, follow all the protocols, and make sure that we keep ourselves safe. And at this point in time, I want to urge persons to get vaccinated. I believe we have enough time to get vaccinated. Carnival is in August. We just announced that, and we are in February, the end of February, so we have all these other months to get ourselves, or at least 2 months ahead, to get ourselves vaccinated. We thank all our stakeholders for being patient over the 2 years of the pandemic. And we encourage all to continue to follow the protocols, as I've said before, and guidelines which will be outlined for the safe hosting of Spice Mass 2022. The Spice Mass Corporation will host a press conference next week, and further details will be given on the rollout of the events. It's not business as usual. We have to follow the protocols, and we have to organize how we're going to roll out this Spice Carnival 2022. So a lot of work has been done, and we are ready now to roll out the details so that the public will be aware of what has to be done, how we're going to work together as a team to ensure that we have a successful carnival. So I am happy to be here, and I know you're happy to hear me announcing that we're going to have a carnival this year. But as I said before, we have to be mindful of the protocols. We have to ensure that we follow the policies, the national policy that government has, and all the protocols that have been still there established.
Thank you so very much, Minister. So, colleagues and viewers, you've heard from the Honorable Minister, Spice Mass 2022, August 8th and 9th. Colleagues, any questions for the Honorable Minister?
Details. They happy?
Linda Straker, good afternoon again.
Good afternoon. Right, the minister made this announcement and she further said that Spice Mass will be having a news conference sometime next week. But can she share with us how the blend will work based on the proposal that was sent? The blend of virtual and in person. And she did mention how they would have received the proposal. So from the proposal, how would that blend function?
Linda, thank you for that question, but as I told you, the corporation will unfold all the details next week, and you would have the opportunity to question them and ask them all of the questions that you want regarding Carnival. I am here today to announce Carnival, that we are having Carnival, and to prepare the groundwork for the press conference next week. So you'll get all the details next week. They are now working on unfolding all the different specifics of the the carnival, and I'm sure next week we would have all the information so that we can prepare for a successful carnival.
Thank you. Linda, any other question?
How difficult was the cabinet to agree to the proposal, please?
Can you repeat that, Linda?
How easy or how difficult was it for the cabinet to agree to the proposal? Earlier on, we would have learned that the committee do recommendations to the cabinet, but the cabinet have the final say. The minister earlier mentioned that a proposal was submitted, and all of this would have had to go to the cabinet. Can she tell us how easy it was for the cabinet, or whether it was a difficult debate in making that decision?
Well, thank you, Linda, again. It wasn't very difficult because we had the reports from the Ministry of Health. We have had other reports from the police. So it's not just the team, SMC, preparing the proposal, but a lot of groundwork and a lot of research has been done, and a lot of collaborative efforts with all the mass players, etc., and all the stakeholders. Bringing that to cabinet, we were very impressed because it was pretty much holistic. It created quite a balance in terms of the information that was shared to cabinet. So it wasn't very difficult for cabinet to make that decision based on the information that was shared.
All right, Nancy McGuire, good afternoon again.
Good afternoon, and good afternoon to the minister. I wonder if she can give us an update on the progress with the cultural aspect of what's going to be presented showcasing Grenadian arts and culture at the Cricket West Indies. And in terms of artists and craftspersons importing machines to improve their production or increase their production, where should they turn for help? Thank you.
Thank you, Nancy. To answer the first question, preparations are being made now to showcase our culture and our carnival and our culture at the Cricket West Indies games. There's a committee in place, and they are now preparing their activities for exposing our culture on those days. There is a plan in place, and that too would be unfolded, but there's a lot of planning taking place, and some persons are contracted to prepare some of the information so that we can have a holistic and a balanced plan. So that is in place at the moment, and we intend to roll that out as well. But there will be the showcasing of our culture during cricket.
Nancy, you had a second question?
I think she's...
Yes, I'm thinking about these craftspeople and artists, etc., that would be hopefully showcasing at Cricket World Cup. But at the Cricket West Indies event, sorry. But for them to get machines, I'm just asking where they go to help to get some assistance in that.
Well,
Because
I
some of them
think
wouldn't be able to afford it.
okay. Well, Nancy, I think the GTA is the one coordinating that activity, or the activities for that particular for event, and so I'm sure they will. I do not have all the details, but I know that GTA is the one spearheading, along with Spice Mass Corporation. They are working together to put all the activities and all the support services together for that for Cricket West Indies. So any of the entities should be able to answer some of the questions that they're asking.
That's it, Nancy. Callistra, good afternoon again.
Good afternoon, Minister. How are you? I would like to find out whether or not the proposal from the corporation was accepted wholesale, or did the cabinet have its own suggestions, or any additions, any takeaways from the proposal that you received, or whether it was accepted wholesale? And has cabinet been advised yet on this may have been addressed in the earlier part of the briefing today, but has cabinet been advised yet on the mass gathering situation in terms of numbers and any changes there in the regulation?
Okay, just to answer your first question. The proposal was torn apart. It's not something that just came to cabinet and it was just accepted. It was discussed. It was, I would say, torn apart because members of cabinet, asked several questions at different angles. But I think they had the corporation, the presenters had adequate information. They have done their work, because they have not done that by themselves. They worked together as a team. They had consultations with the different stakeholders, the mass bands. They even spoke with civil society and, different political entities as well. And the whole thing was discussed because we believe that you couldn't just come to cabinet. They believed that they couldn't just come to cabinet with just something from them. And they had to go there and get all the information necessary and get the feeling of the public out there. Because you know what it is, some people, they think that, the pandemic is, and we may not have carnival, or we should not have carnival, and, things of that sort. So that was deliberated on, and cabinet, the committee was asked to go back as well and review certain aspects and come back with certain information that was needed to really get the whole thing endorsed. So it was not just, it was presented to cabinet and cabinet said, okay, we are looking out for the safety of our people. We are very concerned that persons have been inside as well. Even myself, I was very uncomfortable during the pandemic days. I mean, I couldn't go to places that I wanted to go, and I couldn't have the fun that I wanted to have as well. And so all of that was taken into consideration. There's a number of different angles that we looked at it from. Because coming out here today to tell the nation that we have in Carnival, it could be just risk, because we don't know when the pandemic is going to float up again. We don't know. We have to be careful, but we have to live. We have to live. We have to live and enjoy our lives while we live. So all of that was considered, and I was very happy to present to cabinet that document, and was very pleased when cabinet endorsed it.
Callistra, regarding your second question, the Honorable Minister for Health did mention about
Mass gatherings.
And that they were still discussing regarding non-vaccinated persons. So you can just go back to the beginning of the press conference and you'll get the information there. Do you have any other questions, Callistra?
Okay, no problem. Is Spice Mass Corporation asking cabinet and government for anything additionally above what is normally made available to the corporation for the festival, because we are doing it under pandemic conditions? What are the special asks or special conditions that they would like government to fulfill to make Carnival happen?
One, the support of government, two. And two, A budget was presented. They presented a budget, a support budget as well for Cabinet's consideration.
That's it.
Is the budget bigger than what has been given by way of the annual subvention in the past? Bigger or smaller? How does it compare?
Well, not to that extent, Kalisha, but there have been an increase.
Yeah. And can you say what the amount is, please?
I don't have the details. I didn't work specifically with the details. But you'd get all of that. Next week, all of that will be unfolded. All these questions could be asked next week.
Right, that's it, Kalisha? Okay, great.
Yes, thanks.
Colleagues, anybody else with a final question before we wrap this up? Minister, all right, so you have the final word.
Okay, so thank you again, and thank you, members of the media. Again, I want to reiterate the point that we are in a pandemic. The virus is alive, it's right around us, and changes could take place. Today we announced Carnival. We do not know in the next 2 months what can happen. We may have to go back to the drawing board, or we'd have to work and live, as much as possible, work with what we have at the moment. So I just want to encourage persons. All of that can go away if we get vaccinated. We have been clamoring for that over and over, and I think we want to enjoy ourselves. We want to go back to normal. We want to have the fun. We want to do the things that we want to do, and so that is preventing us. So I'm encouraging all of you out there. Carnival is in August. We have announced the dates. You have how much months? You have over 3 months, March, April, May, to get vaccinated. You want to play mass, you want to play Juve, you want to jump up, you want to have fun, you want to be like the days that we used to have so much fun together out there. Please go out and get yourselves vaccinated. Look, we have cricket coming up. And a lot of persons have been calling me, is there a space for us to sit? Unvaccinated persons? No, there isn't. Why? Well, Minister Steele explained before. You have to get vaccinated. It's something we have endorsed. It's part of the criteria for the games, etc. So again, I just want to encourage you all, please, let us work together. Spice Mass has presented something. You would hear about it next week, sorry. And we're asking you to support, work together, work with us to support the plans and the programs that they will be unfolding next week, so that we can have a successful carnival here in Grenada, and we'll boast about it, I just want to also encourage those of you who are going to Carriacou this weekend to play a mass clean. As Minister said before, moderation is key. I know some of you will get a little out of it because you haven't been in it for quite a long time, but please, don't forget the word moderation. Enjoy yourself moderately. With these few words, I want to wish you all the best. Have a happy weekend in Carriacou. Thank you.
Thank you, Minister, Honorable Minister Yolande Bain-Horsford, Minister for Sports, Culture and the Arts, Fisheries and Cooperatives. We thank you so much. And of course, I'm sure a lot of people are happy with the announcement that we will not be going a third year without Carnival. So as she mentioned, Carnival is on the 8th and 9th of August 2022, but it will take a blended approach in-house. We will have an in-house and, of course, virtual audience, and we know there are activities happening this weekend in Carnival, and as they've been saying, please just do everything in moderation. Yes, we know you want to let loose a little bit, but there is life after Carnival, whether in Carriacou or Grenada, so let us be safe. So thank you, Minister. We also want to say thank you to the Honorable Minister for Health and Social Security, Nickolas Steele, as well as the Acting Chief Medical Officer, Dr. Taisha Donald, and colleagues. Thank you as well for all your questions, joining us via Zoom, and to the viewers who joined us on the Channel 22 of Facebook page, YouTube channel, the live stream, and those of you, of course, in the diaspora. Have a very good afternoon. We will see you again next week.